cervical cancer screening can lead to the prevention and early diagnosis of cervical cancer. Our guest on this week's Health Talk will discuss women's health and why cervical cancer screening is so important. So stay tuned for an important show that could save your life. Health Talk is up next. Hi, I'm Dr. Eric Mazer. Today our topic is women's health. Joining me is Dr. Khushali Shah. She's a primary care physician with Danbury Hospital. Khushali, great to have you here. Great to have you joining our medical staff. I know you're new to the area, new to practice. And so we're going to talk about women's health and predominantly looking at cervical cancer screening. Before we talk about screening, there has really been a revolution in cervical cancer in that vaccinations are available. Tell us a little bit about that vaccination, who should be getting it. It's really a major advance.
Right, so the vaccine that's available for cervical cancer is really great because you can, it's called the HPV vaccine. So it stands for human papillomavirus vaccine. So HPV is one of the infections that can is related to causing cervical cancer. So it's recommended for both males and females. And CDC just came out with a new guideline that says that children, when they're 9 years old, you can start offering the vaccine to them. So if you give the HPV vaccine between ages 9 and 15 years old, you can give them in 2 doses. So the first dose they can get, and then the second dose will be 5 months later. So the interval needs to be 5 to 6 months between the 2 doses. And then if the child is, the adolescent is 15 years or older, then you can do 3-dose series. So you can give it, the first vaccine you can give, and then the second vaccine would be 1 to 2 months later, and the third
Why give more doses to the older children versus younger?
Because the CDC thinks that it takes longer for the immune system to sort of develop a robust response. So they recommend 3 doses for older. So between 15 years to 26 years, they recommend 3 dosages, and also for immunocompromised patients.
Let's take a couple of steps back, because I think this understanding that human papillomavirus plays a central role in the development of cervical cancer is relatively new. I won't say it's brand new, but it's pretty amazing that we now know that most cervical cancer is caused by a couple of subtypes of this papillomavirus. And so that if you are immunized against the papillomavirus, it almost eliminates your chance of getting cervical cancer. So I don't think people really realize it. This is one of the things we've sort of wished for decades, and that is a vaccine to prevent cancer. And at least with cervical cancer, we have that.
Right.
Now there's a lot of controversy, not a lot, but there's some controversy because HPV is spread by sexual contact. And so it's, I know that there are some families that believe somehow getting vaccinated is giving permission to their children to have early sex. Do you want to say a few words about that?
Yeah, so HPV is predominantly spread by genital contact. So the vaccine covers several strains of the HPV, but there is 2 categories of strains, so the low risk and the high risk. And there is 15 types of high-risk HPV and 10 types of low risk. So those are the most common. So the vaccine will protect you against those. But there's so many other strains out there that the vaccine doesn't protect you against.
So it's not 100% effective.
It's not 100% effective.
I don't know, is it 90? Do you know what the actual rate is of prevention?
So I'm not sure I'm not exactly sure about the number, but it's pretty high, more than 80%, I would say.
And maybe to explain to folks at home, the problem is once you've gotten one of these HPV strains, some people don't clear it, and it's too late to get the vaccine once you've gotten it. So what you want to do is vaccinate children or adolescents before they become sexually active.
Right. So that's the idea, but CDC does recommend to protect adolescents or adults up until age 26. So even if you have been sexually active, if you're under 26 years of age, you can still get the
Because
vaccine.
you may not have been exposed to one or many of the strains that the vaccine covers.
Right.
And so this is just like measles, mumps, chickenpox. You can prevent that. Do patients know they've been infected with HPV?
No, so there's no sort of signs and symptoms of knowing whether you're infected, but that brings us to our next topic, was cervical cancer screening. So for females, we can do what's called a Papa-Nicolau smear.
Which everybody knows is the Pap smear.
Pap smear. And there's different intervals depending on how old you are, but that test will help us determine, along with, if they do the HPV testing along with the Pap test, it'll help us determine whether you're infected with HPV and whether it has caused changes in the cells in your genitals.
And before we go into, I want to definitely talk more about cervical cancer screening, but going back to the HPV vaccine, now recommending that young boys get it too, right?
Right, yeah.
And maybe because boys don't get cervical cancer, why should they get the HPV vaccine?
Yeah, because it can also, HPV doesn't just cause cervical cancer, it can cause, any type of genital cancer. So if the cells in your genital area are affected, it can cause, cancers of the skin around your penis or testicles, or so boys are just as much as at risk as girls.
And plus, we don't want the boys transmitting this virus.
Exactly.
So it's not, this is, you vaccinate your boy to be, because a lot of those cancers are fairly rare, but we should be vaccinating our male children because that helps them be good citizens and not spread around a virus that can cause cervical cancer.
Exactly.
And we talk about herd immunity. Maybe you want to say something, because if we get enough people vaccinated, we should be able to dramatically reduce the incidence of cervical cancer, shouldn't we?
Definitely, definitely. At least against the strains that the vaccine protects against, we should definitely be able to, herd immunity would work in this situation as well.
Yeah, what herd immunity means. Why don't you tell us what herd immunity means?
Yeah, so if enough patients are vaccinated with the HPV vaccine, will prevent transmission. So, if we get enough people, we'll reduce the prevalence of the disease itself.
Yeah, so the herd of us humans, susceptible, gets reduced small enough, the vaccine has trouble getting around.
Exactly.
And we've seen this with things like measles that we had almost eliminated, where people had stopped getting vaccination, we lost our herd immunity, and we've started to have these pockets of measles in older children.
Exactly.
So this is something that's as I said, it's controversial. What do you tell your patients when they say, well, I don't want my child to have sex till after they're married, so I don't want them to get this vaccine. It shouldn't be necessary for them. What do you say?
I would still, I would try to convince them and still recommend the vaccine, because not all children would be, as forthcoming about their sexual activity and sexual life to their parents. So just for the protection and safety of their children, I would still recommend it to those parents.
Yeah, there's nothing, you're not giving permission for anything. You're just protecting your child.
Exactly.
And I think we all want to protect our children.
Definitely.
And you're also protecting other people. And this is a disease we really should be sending to the scrap heap. I realize it's not the vaccine's not 100% effective, but it certainly is highly effective, and I'd like to see more people getting it. Do you screen patients when they come into your office for the first time and they're young? Do you talk about the vaccine with them?
Oh, definitely. One of the generic names is Gardasil, so I always bring that up because you see commercials on television. So I definitely, if they're younger than 26 years old, I definitely bring it up and I give them the option. And more often than not, everybody,
That's what I was going to ask. Are you seeing much resistance, or most people say?
No, they're very, because everybody wants to protect themselves against cancer. So they're very, forthcoming about getting the vaccine and protecting themselves. So I haven't met with much resistance. Yeah.
So we've said that, okay, so we can probably prevent cervical cancer in most folks. But you talked about screening. Screening's been around for a long time. The pap smear has been around, and I think recommendations have evolved over time, so it's not quite as intrusive as it used to be. But what do they do? Tell us a little bit about what are people looking for when they're getting a pap smear? Or what are doctors looking for when they do a pap smear?
Yeah, so pap smear is one of the screening methods that we use. There's 3 other different methods too, but for the pap smear, so in females, we typically do it as an annual physical exam. So we do a pelvic exam, we take a speculum, we insert it in the vaginal canal, and we look at the cervix. We'll look at the appearance of the cervix, make sure there's no lesions on it, make sure it's healthy appearing, and then we take samples of the cells that are in the cervical canal and also outside the cervical canal, and then we send it to them.
I should point out, I guess most women who have had them, but if you haven't, I've never had one, but I've done them, and you're just taking a wooden stick, almost like a tongue depressor, and scraping gently around the cervix.
Right.
You're not taking a biopsy. It's
No.
I know some people, it's an uncomfortable exam, but it's not, people don't complain that it's terribly painful.
No, it's you definitely have some discomfort while you're doing it, but it disappears once it's over. And yeah, like you said, it's the small brush that goes in and out of the cervix, and it takes less than a minute to do. And when we send it to the lab, what they're looking for is they observe the cells that are in the cervical canal and outside the cervix.
They look under the microscope at
Under
these
the
cells,
microscope, yes. And then they make sure that they're healthy appearing, that they're not infected, their appearance is not abnormal. And if it is abnormal, then when it comes back to us, we send it for HPV testing to see if the HPV infection is causing the cells to be abnormal. So,
if it is, what do you do?
So if it is abnormal, it depends. So what we see under the microscope for a pap smear is called cytology. So if the cytology reports abnormal cells and if the HPV is also positive, then we either repeat, depending on what kind of strain it is, if it's a high-risk strain of HPV or a low-risk strain, we either do a repeat testing in 1 year, or we send them to gynecology for a colposcopy, which is a more involved procedure.
Does that remove some of those cells?
Yes, yeah, that's the idea.
There's no treatment to clear the HPV, is there, right now?
No.
So we don't really have drugs that we know of that can cure the HPV.
No.
So it's really a question of preventing it rather than curing it once you have it.
Exactly.
You said there were 3 tests, so keep going.
So the first one we discussed is pap test
and we have
alone.
1 minute left.
Okay, sure. And the second test is pap test with reflex HPV testing. So if it's positive, you do the HPV. The third test is just HPV by itself, which is just United States Preventative Services Task Force, which comes out with all the guidelines, said that you can do that every 5 years. And then there's HPV testing with reflex pap smear. So those are 4 different kinds.
Is one better than the other, or they just simply, you choose one and go through that process, or how do you integrate those two? Those 2 options being the HPV testing and the pap smear.
Yeah, so none of the methods are superior than the other, according to randomized trials. But if you're 21 years to 30 years, we typically don't test for HPV because we spontaneously clear it. So in that age group, we recommend just pap smear.
We haven't explained that yet, but you're right, we don't have much time. But some people just clear the HPV and it's not a problem. Yeah. We can't predict who that is. But
right, but if you're younger than 30, then the chances of clearing it are higher. But over 30, you will have difficulty clearing it on your own. Yeah. And
then I know as people get older, if they're monogamous, the need for doing cervical pap smear testing it can be spread out.
Yeah, the interval can be spread out to every 5 years if you do HPV testing, and if it's normal, if it's negative, then you can spread out the interval to every 5 years. And if you have 2 if you have two negative HPV tests in a row, and if you're approaching 65 years of age, then you can stop screening at 65.
Okay, so there's something good about being 65.
Yeah.
Unfortunately, we've run out of time. I really want to thank our guest, Dr. Khushali Shah, for joining me on Health Talk today, talking about a very important topic. And also thank you for watching. Please remember to call us at 203-852-2250 with your questions or comments. We'll see you next time.
Spot a stroke, F-A-S-T, fast.
Depression and anxiety are common mental health issues. Experiencing occasional anxieties is a normal part of life. However, when it begins to affect your everyday life, it is important you know that treatment is available. On this week's Health Talk, a primary care physician will discuss anxiety and depression and treatments. So we're up next. Don't go away. Anxiety and depression are our topics on Health Talk today. Joining us is Dr. Khushali Shah. She's a primary care physician with Danbury Hospital. Great to have you on the show.
Thank you for having me.
Been very anxious to have you. We're going to talk about anxiety and depression. I think everybody gets anxious now and then. Everybody gets blue now and then, feels depressed. But these are also mental health disorders. What's the difference between a problem with anxiety and depression, or depression and just normally being depressed?
That's a very good question. So we have the United States Preventative Services Task Force is the national, they provide guidelines for clinicians and patients, and they have recommended that at every visit, the doctor's visit, when a patient comes in, we give them a questionnaire, which is called a PHQ-2, Patient Health Questionnaire. It has 2 questions, and it asks whether you have been feeling down or depressed, and it gives you the option, every day, nearly every day, things like that. And then you pick one, and then the other question is, do you feel hopeless or depressed? So that's a screening questionnaire that we give patients, and if they score more than 3, if the total is more than 3, then it's a little concerning. So we give them a bigger screening questionnaire, which has 9 questions. It's called PHQ-9, and then depending on the score, so it's 5, 10, 15, 20. So the 5, if they just score a 5, that means they have mild depression. But if they score a 10, it's moderate. 15 is severe, 20 is more severe. So that's a sort of a way to quantify.
Sort of a way that we can quantify.
Right.
But how does somebody sitting at home know that their depression is more than they should have,
right,
more than is normal, and where seeking help might be what they should seek help or advice? So what are the clues at home?
Right. So if you feel, so there's several clues. So the first one being, if you don't sleep well at night, if you toss and turn, insomnia is number 1. Then if you lose interest in things that used to interest you before, if you can't concentrate like you used to, if you don't have enough energy that you did before, you either eat too much or you don't eat at all. And you can't sit still, you constantly have the urge to move around, or if you have thoughts of hurting yourself or hurting others, those are sort of, and if you have all these symptoms for about 2 weeks at least, then that's concerning and you should probably see a healthcare provider.
I've heard it also said that when it begins to interfere with your normal life is when you should. So if you, as you said, if you normally like to go out on Saturday nights and you stop wanting to go out on Saturday nights, or you can't get out of the bed in the morning, or you, whereas normally you've been able to. So but it's hard because depression, as you said, is normal. Anxiety is normal. It's part of our fight and flight response, and yet these can be problematic. And the reason we're talking about them in the same breath is they really are manifestations of the same disorder.
Right,
It's a
exactly.
continuum.
Exactly.
Usually depression and anxiety go together.
Go together, yeah, exactly. So, some people can have. The reason we're talking about this is because it's so prevalent in our society. It's the second cause of disability in the United States and 11th in the world. And
That's incredible. I didn't realize it was that high.
it's very high, and when you have just one episode of depression, the recurrence increases tremendously. So it's a very recurrent disorder. So, I wish it was just, one time you feel that way and you feel better and then you're done, but it's not like that. So the rate of recurrence after the first episode within 2 years is more than 40%.
Wow.
So it's pretty significant. So it's very crucial to get help if you think that something is just not right, something, you know your body the best.
Mm-hmm.
So if you consistently feel that you just don't, you feel just down, you should get help.
And something I'm realizing more and more is probably more and more common is seasonality to the depression.
Mm-hmm.
We have this term called SAD, seasonal affective disorder,
Mm-hmm.
where people tend to get depressed as sunlight goes down.
Mm-hmm.
And it turns out that that's a really real phenomenon and really pretty common, I think.
Exactly, especially during winter months, because 4 or 5 p.m. it's dark outside. So, but there are, fortunately for the seasonal affective disorder, there is conservative things we can do, like buy something called a happy lamp, or that sort of.
Yeah, this is not hocus pocus. And I think it's really amazing. A happy lamp, it sounds sort of silly,
Yeah.
but exposing yourself to more bright light at certain wavelengths each day
Can really make a
affects
difference.
things.
Yeah, exactly. I definitely, in terms of treating depression, we definitely should try conservative measures first, to see if that would help. Because, so conservative measures, I mean, talking to a family member first and see if that helps you. Sometimes just social interactions help. We can also, have therapy sessions when you can either do something called cognitive behavioral therapy, where you sit down with a therapist and you talk about how you've been feeling, and they try to come up with a plan of how to rewire your thinking process. And you go to several sessions, and that is very beneficial for some patients. So I know there's sort of.
I'd also like to mention, I think, mainly because I personally have found it very useful, is that for the anxiety side of depression, things like meditation and mindfulness really are effective at helping you. Even just breathing, certain breathing exercises are a way of capping your anxiety and pushing it down.
Definitely.
And these are not drug related, and they cost nothing.
Yeah, it's called self-help therapy. There's a term for it. So definitely meditation has shown, you just have to do 10 minutes a day. Just carve out some time for yourself. Sit in a quiet room where no one can bother you. And there are so many apps on the phone now that and they have 10-minute session, they have 20-minute session, depending on how much time you have. But the key is consistency. So you can't do it once and expect results.
Right.
So
And it's almost a learned process. You don't sit down and suddenly reach some state of nirvana.
No.
You have to practice it, and as you said, do it regularly, and then you begin to feel some change in the way you're relating to your environment. The other thing we didn't mention is exercise in terms of common therapy. You want to say something about that?
Yeah, there have been so many studies and trials that have shown that physical activity really helps tackle depression and anxiety. For anxiety, definitely, because you have so much anxious energy built up. You go for a run, you go for go to the gym. You can sort of work out your anxious energy, and it's said that even as little as 30 minutes of aerobic physical activity can really help, with depression and anxiety.
So there are a whole bunch of. First, we want to recognize this and recognize that this is interfering with your life, and as you said, and certainly if you're thinking of hurting yourself, if you ever think of, you should really get help at that
Definitely.
point, because this is suicide is a major cause of death in our society, and it is something, it should be preventable. And the other thing I know that people will say is, as bad as you feel in the depths of your depression and this sense that there is no way out, people come out of it all the time.
Right.
You can get beyond that point. I know there's a feeling of, you said hopelessness, and that, oh, here I am for the rest of my life, I'm going to be trapped in this miserable situation. And it's just simply not true. Even for the worst people, there are treatments available.
Definitely. Seeking help is the #1 step. And that shows you that, that it's not a sign of weakness.
I was just going to say this.
Right. It's not a sign of weakness. It's actually very courageous to tell someone that you feel this way and get help. So,
And hopefully, I think the stigma is less now than it was perhaps 20 or 30 years ago. But we still haven't gone away with it. I think there are more and more sort of role models out there, rock stars or whatever, who are admitting that they've had problems with depression. But we need more people to come out and say that this is something that's affected them, but also that there's a way through it.
exactly, yeah. And for patients who conservative measures don't work, if the meditation doesn't work, if therapy doesn't work, we do have medications. And there's also stigma associated with medications too, but you have to realize that we start someone on an antidepressant and we trial them for 6 to 12 weeks, and if we see a drastic difference, if it's night and day, some people do mention it as night and day, then it's not it's not subjecting you to a lifelong treatment. We can definitely taper you off of it when the circumstances around your life change, when the stressors go down. So it's not a permanent thing.
And the medications are really have evolved tremendously, and I think we can emphasize that. There were, again, back when I first started practicing, there were limited numbers of medicines, some of the tricyclics, amitriptyline, Elavil, that people heard, and they were modestly effective, had a lot of side effects, but the generation of drugs now, the SSRIs, the selective serotonin reuptake inhibitors, and the others of that ilk, especially some of the modern ones, are really very effective and very clean drugs. I don't know whether you want to say something about it, but they really do work, and they don't turn you into a zombie, and you don't feel differently. They just sort of take the edge off things.
Yeah, and there are side effects to every medication. So what we typically recommend is you start a patient on a very low dose and see how they do. So if the starting dose is 50 milligrams for a medication, we start at 25 and see how they do. And most common side effects are, just the usual stomach. You feel some irritation in your stomach, some nausea, vomiting. But most of the patients, the benefits outweigh the harm. So
I think with some of them, we do have to be careful in the younger population, because there's this odd phenomenon of worsening before they get better, and there's a higher incidence, again, usually of young people, of suicidal issues shortly after you start some of these medicines. So as you said, starting them low, watching patients carefully during that initial phase, and understanding that also the other thing is that the effects may take several weeks to be manifest, which is not, again, it's not like the old Valiums or the I guess that's what most people are most familiar with, where you take it and your anxiety, 30 minutes later is feeling better. These drugs really have a cumulative effect they change the brain chemistry.
Exactly.
And it takes a while for that shift to occur.
Right. But, we do see the first effects within 1 to 2 weeks for some of these medications.
I actually read a paper recently that said we were sort of taught 6 weeks, and then it said the 1 to 2 week is actually more common than we had believed.
Exactly, yeah. So, and I wanted to point out that, the Valium and the Xanax, what is called the benzodiazepine class of drugs, they provide relief in the short term, but they have a lot of long-term abusive potential. So
and they're nasty to get off of.
Exactly.
They're nasty to taper and stuff.
Exactly. So
especially Xanax, just because it's so common, and that's why I'm singling it out. But that's a nasty drug to try to discontinue.
Exactly. So it's better. So that's just sort of a temporary treatment. It's sort of a bridge to a longer term.
And we have. And we've run out of time. Now, this is such an important topic. I think we could do a whole hour on it, but because it's so common. But please, if you're at home and you're having problems, get help, because these drugs work, and they work very well, and you're not an addict. You can stop them. They're really very effective. That's all we have time for today. Please, if you have questions or comments, please call Community Relations at Nuvance Health, 203-852-2250 with your questions and comments. We'd love to hear from you. I also want to thank my guest, Dr. Khushali Shah, for spending time with us today, and thank you for watching Health Talk.